Hello everyone, Tony here. So I received a private message from an individual from the Total Knee Replacement Support Group. And I thought this was important enough of a message that I wanted to share it, and I wanted to give you my response to it because this is going to be a more common scenario and I want you to understand your options. Now, let me tell you, the videos that I record specifically on insurance reimbursement are usually not very popular, but this is a topic that I think is going to affect everyone moving forward. So I know you can't read my screen. I'm going to read the message and then we'll talk about it. So to paraphrase, my doctor gave me exercise to do at home. The only therapy I got was when I was in the hospital, and the doctor's office said that I would not be getting PT. His secretary mentioned something about Medicare has gotten to the point that they don't want to cover PT, which is totally wrong. So that is completely inaccurate. Then she said that Blue Cross Blue Shield tends to go right along with what Medicare does, which is true from the perspective that Blue Cross in this case is the supplemental plan. They'll do what Medicare does, but it's patently wrong that Medicare doesn't want to cover PT after a knee replacement. That's just not true. She said that Medicare feels that the person does better at home doing exercises by themselves. Also, that if a person doesn't think they'll get better, why have someone force them to do it? I really don't understand why, because two of my sisters had a total knee replacement a couple years ago and PT came to their house. So here's the deal. I teach a course for physical therapists to understand Medicare. I've reviewed all the Medicare guidelines. I can cite references. Medicare absolutely 100% covers physical therapy after a total knee replacement when it's medically necessary. Typically, and at least at the minimum, the initial evaluation, the plan of care, teaching you what to do, supervising your progress, all of that stuff, establishing goals, all of that stuff is totally covered by Medicare. The most common scenario would be 2, maybe 3 days a week. As you improve, the frequency reduces. As you get to do more on your own and build more confidence and you're on your feet and you go from a walker to a cane to no assistive device, yes, therapy would be reduced, but it's absolutely part of the outpatient rehab experience. Now, you have two options. You can receive home health physical therapy under Medicare Part A. That's typically when you're homebound and you require nursing. The other option is what we call outpatient physical therapy under Medicare Part B. Now, if you have a Medicare replacement plan, Medicare replacements are Part C. They're also called Medicare Advantage. That's a different scenario. I can address that in a different video, but for this, we're going to talk primarily Medicare Part B. So if you have Medicare Part B coverage, if you are not homebound, you don't need nursing, you can receive outpatient physical therapy services as long as it's medically necessary. And I can tell you, 20 years experience, I've never seen a patient discharge status post right after a total knee replacement in which it wasn't medically necessary. You need somebody to help keep an eye on the incision, to keep an eye on the swelling, to help let you know if what you're doing is right. Absolutely, you don't need somebody 24 hours a day, 7 days a week, but to have that therapist on your side 2-3 days a week to assess your progress, to answer your questions, to help you along, that's what we're here for. That's what we went to school. So here is the big kicker. You do not need a physician referral to start outpatient physical therapy services. Whether it's outpatient in your home or outpatient in a clinic, those are two of the options available under Medicare Part B. You do not need a physician referral to get started. You need a physician who's willing to sign off on the physical therapy, who's willing to review the plan of care and confirm that you are under the supervision of a physician, a surgeon, something like that. So if your surgeon is not willing to recommend physical therapy and sign off on your plan of care, I'd go straight to your primary care doc. I'd go sorry, I'd go to another physician. I would find somebody who is on your side, because this is a major medical event. Having somebody to guide you through the process. These videos that I produce are nowhere near as effective as having a real person with you. So please understand, physical therapy is absolutely still a covered service under Medicare, under commercial insurance, under just about any third-party payer. Yes, there is some truth to the fact that they're trying to reduce the amount of therapy that an individual might receive after a knee replacement, simply because a lot of people have gotten 35, 45, 50 visits, and maybe they didn't need that many. But at the minimum, you need a physical therapy evaluation, develop a plan of care, somebody to assess and supervise your progress, make sure you're doing everything correct, you understand what to do, and somebody who will progress your program. Okay, guys, if you have questions, if you need support, if you want documentation or anything like that, post your questions in the YouTube comments. Again, I always appreciate any time you agree to subscribe to the channel, like the video, and especially if you can share this video. If there's somebody you know who should be receiving physical therapy and they're not because their physician said they're not allowed or some other nonsense, send them the video. Maybe they get some information that'll be useful. Guys, I appreciate it. I'll catch you on the next video.